The other lesson we learned is the importance of communication, which is kind of interesting because I am a speech-language pathologist by background, and communication is our mainstay. But as a research team, when we started out, we had a whole plan designed around how to communicate with all of the frontline people who would be impacted by our introducing this new service delivery. And so we did tons of presentations and we had all kinds of materials, but we focused on the frontline folks. We hadn't really thought about there's a whole bunch of other people who are in schools, in health organizations, who work there, who don't have to do this model directly, but they're going to see the occupational therapist in the school, or they're going to have some contact with our program. And in order for us to have the best and most seamless entry, we have to help them understand it too. And some of the early barriers we encountered were around people not understanding what the project was, why was the OT in the school, what was her role, what was this project, what was Partnering for Change. And so going into year 2, we actually made sure that we did very widespread across whole organizations, that we met with groups that even if they weren't the people implementing it or touched by it directly, that they knew why we were there, what we were doing, that we had them opportunities for them to ask questions. We now tailor our presentations. We don't give one standard presentation. We tailor, if we're talking about this intervention to speech-language pathologists, which I do, so I go give the presentation, I'm an SLP, but I tailor it for them. I really put in information that's specific to them and their needs about it. We tailor to school psychologists, we tailor to special education resource teachers. So that's one thing we've learned, is this idea of communication, messaging, tailoring.